Hey parents, welcome back to Healthy Child Habits. Today we're diving into something that affects 60% of children by age 5, baby bottle tooth decay and the dental care mistakes that lead to it. If you've ever wondered whether you're doing everything right for your child's teeth, stick around because we're covering the 8 biggest mistakes parents make and, more importantly, how to fix them. Before we jump right in, consider subscribing to this channel for more evidence-based health facts for your child and toddler. Mistake number 1. Prolonged bottle use with sugary drinks. This is the big one that catches so many parents off guard. You put your toddler to bed with a bottle of milk or juice thinking you're helping them sleep better. But here's what's actually happening. Those sugary liquids pool around their teeth for hours while they sleep, and the bacteria in their mouth have an all-night feast producing acids that eat away at tooth enamel. This leads to what dentists call early childhood caries or baby bottle tooth decay. And trust me, it's not pretty. We're talking brown spots, cavities, and in severe cases, teeth that need to be extracted before they even fall out naturally. So what should you do instead? Start introducing cups at 6 months old, even if it's just for water at first. By their first birthday, you want to transition completely away from bottles. I know, easier said than done. But here's the thing, the longer you wait, the harder it becomes. If your child absolutely needs something to fall asleep with, make it water only. No milk, no juice, no formula in that bedtime bottle. And here's a pro tip, start diluting those bottles gradually over a few weeks. More water, less milk, until eventually it's just water. Most kids won't even notice the change if you do it slowly enough. Mistake number 2, skipping the nighttime brushing routine after milk. Raise your hand if you've ever let your little one have a glass of milk before bed and then skipped brushing because they were already half asleep. Yeah, I see you, and you're not alone. But here's why this matters so much. Milk contains lactose, which is a sugar, and when that sugar sits on teeth overnight while saliva production decreases during sleep, it creates the perfect environment for cavity-causing bacteria to thrive. Even breastfed babies aren't immune to this. The fix is simple but requires consistency. Brush after that last milk feeding, every single time. For infants who don't have teeth yet, wipe their gums with a clean damp cloth after feedings. Once that first tooth erupts, use a smear of fluoride toothpaste about the size of a grain of rice and a soft infant toothbrush. Make it part of your bedtime routine. Milk, story, brush teeth, bed, no exceptions. And if your child falls asleep during feeding, gently wake them just enough to do a quick brush or wipe. Yes, it might seem like a hassle, but preventing cavities is way easier than treating them. Mistake number 3, brushing immediately after eating sweets. This one surprises a lot of parents because it seems counterintuitive. You'd think brushing right after candy or soda would be the best thing to do, right? Wrong. When your child eats something sugary or acidic, it temporarily softens the enamel on their teeth. If you brush immediately, you're actually scrubbing away that softened enamel, causing more damage than the sugar itself. Think of it like trying to clean a wet painting. You'll just smear it and ruin it. So what's the right approach? Wait 30 minutes after eating sweets before brushing. During that time, saliva naturally helps neutralize the acids and re-harden the enamel. But don't just sit around waiting. Have your child rinse their mouth with water right after eating sweets. This helps wash away some of the sugar and starts the neutralization process. Even better, give them a piece of cheese or some crunchy vegetables after sweets. These foods help stimulate saliva production and naturally clean teeth. And of course, the best solution is limiting sweets in the first place, but we'll save that lecture for another video. Mistake number 4, letting children brush alone too early. Here's a reality check. Most children don't develop the fine motor skills needed for effective brushing until they are 7 or 8 years old. Before that, they're basically just playing with a toothbrush. They miss spots, they don't brush long enough, and they definitely don't get those back molars properly. I've seen kids who think they're doing a great job, but they're literally just brushing the front to teeth and calling it done. The solution? Supervise and assist with brushing until at least age 7, preferably 8. This doesn't mean hovering over them criticizing every move, but it does mean checking their work and doing a follow-up brush to catch the spots they missed. Make it fun. Let them brush first so they feel independent. Then you do a second pass, calling it the parent polish or the superhero brush or whatever makes it exciting. Use a timer or play a 2-minute song so they know how long to brush. And here's a technique that works great. Stand behind your child and tilt their head back slightly so you can see into their mouth better, just like a dentist does. Brush in small circles, not back and forth. And don't forget the gum line and tongue. Mistake number 5, missing that crucial first dental visit. Most parents don't realize that the American Academy of Pediatric Dentistry recommends a first dental visit by the child's first birthday or within 6 months of the first tooth appearing. But the average age for a first dental visit in the US is actually around 2.5 years old. That's a huge gap, and a lot can go wrong in those 18 months. Early dental visits aren't just about checking for cavities. They're about establishing a dental home, getting parents educated on proper care, and catching potential problems before they become serious. So when should you actually go? Book that first appointment as soon as the first tooth pops through, or by their first birthday, whichever comes first. Don't wait until you see a problem. These early visits are usually quick and painless, mostly just the dentist taking a look, counting teeth, and talking to you about proper care. They'll also check for tongue tie, proper jaw development, and other issues you might not notice at home. After that first visit, maintain twice-yearly checkups. I know dental visits can be expensive and time-consuming, but catching a small cavity early is way cheaper and easier than dealing with a root canal or extraction later. Plus, regular visits help your child get comfortable with the dentist, so they don't develop dental anxiety as they get older. Mistake number 6, not cleaning infant gums before teeth appear. A lot of parents think oral care starts when teeth come in, but that's actually too late. Bacteria can colonize your baby's gums long before that first tooth erupts, setting the stage for problems down the road. Plus, getting your baby used to having their mouth cleaned makes the transition to actual brushing much easier. Here's what to do. After every feeding, whether breast or bottle, wipe your baby's gums with a clean damp cloth or gauze pad. Just wrap it around your finger and gently wipe the gum surfaces. It takes like 30 seconds, and it removes milk residue and bacteria. Some parents use those little finger brushes made for infants, which work great too. The key is making it a habit from day one. Your baby will get used to the sensation, and when it's time to introduce an actual toothbrush, they won't fight it as much. And bonus, this gum massage can actually feel good for teething babies. Mistake number 7, failing to transition from bottle to cup by age 1. We touched on this earlier with the bottle at bedtime issue, but it's worth its own section because the timing matters so much. The longer a child uses a bottle, especially beyond their first birthday, the higher their risk for tooth decay, speech problems, and even ear infections. Bottles encourage prolonged contact between sugary liquids and teeth, and they can affect the development of the mouth and jaw. The transition strategy is gradual but firm. Start introducing sippy cups or straw cups around 6 months, even if it's just for water during meals. By 9 to 10 months, offer milk in a cup during the day while still using bottles for morning and bedtime. Then, around their first birthday, drop the bottles completely. Cold turkey works for some families, while others prefer dropping one bottle at a time over a few weeks. Either way, make it happen by 15 months at the absolute latest. And here's a tip that makes it easier. Don't offer bottles as comfort objects. If your child is upset, offer a hug, a toy, or a pacifier instead. This breaks the emotional attachment to the bottle, making the transition smoother. Mistake number 8, inconsistent brushing routines. This is probably the most common mistake of all. Life gets busy, kids resist, you're exhausted, and suddenly you realize you've skipped brushing 2 nights in a row. But consistency is absolutely critical for preventing cavities and gum disease. Brushing twice a day, every single day, removes the plaque and bacteria that cause problems. Miss a day here and there, and that plaque hardens into tartar, which you can't remove with brushing alone. The solution is making brushing non-negotiable, just like buckling a seatbelt or washing hands before eating. Build it into your routine at the same times every day, morning after breakfast and night before bed. Set phone reminders if you need to. Make it fun with songs, games, or reward charts for younger kids. Let them pick out their own toothbrush and toothpaste flavor. And here's the thing, even when they resist, and trust me, they will, you still have to do it. You're the parent, you make the rules, and healthy teeth aren't optional. Some nights it might feel like wrestling an alligator, but stay consistent. Eventually, it becomes habit, and the resistance fades. So there you have it, the 8 biggest dental care mistakes parents make and how to avoid every single one of them. Start introducing cups early. Transition from bottles by age 1. Wipe infant gums after feedings. Brush twice daily with proper technique. Wait 30 minutes after sweets before brushing. Supervise brushing until age 7 or 8. Schedule that first dental visit by their first birthday and maintain twice yearly checkups. These habits might seem like small things, but they add up to a lifetime of healthy smiles. If you found this helpful, give this video a thumbs up and subscribe to Healthy Child Habits for more practical parenting advice. Drop a comment below telling me which mistake surprised you the most, or if you have any questions about your child's dental care. And if you want to dive deeper into building healthy habits for your kids, check out our other videos on nutrition and sleep routines. Thanks for watching, and I'll see you in the next one.